HIV/AIDS is a major global health issue. It has affected millions of people worldwide. The virus attacks the immune system, making it hard for the body to fight off infections. Understanding HIV/AIDS is crucial for prevention and treatment. This essay will explore the causes, symptoms, and prevention of HIV/AIDS. We will also discuss the latest advancements in treatment. Knowledge is power. By understanding HIV/AIDS, we can work towards a healthier future. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system. The immune system is our defense against diseases. HIV weakens the immune system over time. HIV targets a specific type of white blood cell called CD4 T cells. These cells are crucial for a healthy immune response. As HIV multiplies, it destroys CD4 T cells. This weakens the body's ability to fight off infections and diseases. HIV infection progresses in stages. The first stage is acute HIV infection. During this stage, the virus replicates rapidly. Some people experience flu-like symptoms. Others may not have any symptoms at all. Without treatment, HIV continues to multiply. This leads to chronic HIV infection. During this stage, the virus continues to damage the immune system. People may experience swollen lymph nodes or other mild symptoms. The symptoms of HIV can vary from person to person. Some people may not experience any symptoms for years. Common symptoms include fever, fatigue, and swollen lymph nodes. Others may experience skin rashes, sore throat, or muscle aches. As HIV progresses to AIDS, acquired immunodeficiency syndrome, the immune system becomes severely weakened. This makes the body vulnerable to opportunistic infections. These infections are usually harmless in people with healthy immune systems, but they can be life-threatening for people with AIDS. Living with HIV treatment and care. Living with HIV requires a comprehensive approach to treatment and care, ensuring that individuals can lead fulfilling lives despite the diagnosis. There is no cure for HIV. This means that once someone contracts the virus, it remains in their body for life. However, advancements in medical science have made it possible to manage the condition effectively. However, with proper treatment, people with HIV can live long and healthy lives. Many individuals with HIV continue to pursue their passions, maintain relationships, and achieve their goals. Antiretroviral therapy, or ART, is a type of medication that suppresses the virus. ART works by reducing the viral load in the body, making it less likely for the virus to damage the immune system or be transmitted to others. ART helps to control the virus and prevent it from damaging the immune system. By keeping the viral load low, ART allows the immune system to function more effectively, reducing the risk of opportunistic infections and other complications. ART needs to be taken every day as prescribed. Consistency is key to ensuring the medication's effectiveness. Missing doses can lead to an increase in viral load and the potential for drug resistance. It is important to adhere to the medication regimen. Setting reminders, using pill organizers, and establishing a routine can help individuals stay on track with their treatment. This helps to keep the virus suppressed and prevents drug resistance. Adherence to ART not only benefits the individual, but also reduces the risk of transmitting the virus to others. Regular medical checkups are also important to monitor the virus and overall health. These checkups allow healthcare providers to track the effectiveness of the treatment, make necessary adjustments, and address any side effects or concerns. In addition to medical treatment, emotional and social support play a crucial role in the well-being of individuals living with HIV. Support groups, counseling, and community resources can provide valuable assistance and encouragement. Staying informed about HIV and its treatment options empowers individuals to make informed decisions about their health. Education and awareness are key components of effective HIV management. A healthy lifestyle, including a balanced diet, regular exercise, and stress management, can further enhance the quality of life for those living with HIV. Taking a holistic approach to health can make a significant difference. With the right treatment and care, people with HIV can look forward to a bright and hopeful future. Advances in medicine and a supportive community make it possible to live well with HIV. Preventing HIV transmission. Safe practices for a healthier future. Preventing HIV transmission is crucial. HIV is spread through certain body fluids such as blood, semen, vaginal fluids, and breast milk. It is not spread through casual contact like hugging, shaking hands, or sharing utensils. One of the most effective ways to prevent HIV transmission is by practicing safe sex. Using condoms consistently and correctly can significantly reduce the risk of transmission. It is also important to get tested for HIV and other sexually transmitted infections. Pre-exposure prophylaxis, or PrEP, a powerful tool for HIV prevention. PrEP stands for pre-exposure prophylaxis, a groundbreaking approach in the fight against HIV. This medication is designed to be taken by individuals who do not have HIV but are at substantial risk of contracting it. Pre-exposure prophylaxis, or PrEP, is a medication that can prevent HIV infection. It involves taking a daily pill that contains two medicines, tenofovir and emtricitabine, which are also used to treat HIV. When taken consistently, PrEP can reduce the risk of getting HIV from sex by about 99% and from injection drug use by at least 74%. It is taken daily by people who are at high risk of contracting HIV. This includes individuals with an HIV-positive partner, those who have multiple sexual partners, people who do not consistently use condoms, and individuals who share needles or other equipment to inject drugs. Consistency is key. Missing doses can reduce its effectiveness. PrEP works by blocking the virus from establishing infection in the body. The medication creates a protective barrier in the bloodstream, preventing the virus from multiplying and spreading. This mechanism is crucial in stopping the virus before it can take hold and cause a lifelong infection. PrEP is highly effective at preventing HIV transmission when taken as prescribed. Studies have shown that it is one of the most powerful tools available for HIV prevention. It allows individuals to take control of their health and significantly reduces the anxiety and fear associated with potential HIV exposure. It is important to talk to a healthcare provider to determine if PrEP is right for you. A healthcare provider can assess your individual risk factors, discuss the benefits and potential side effects, and help you make an informed decision. They can also provide regular follow-up care, including HIV testing and monitoring for any side effects. They can assess your risk factors and provide guidance on how to use PrEP effectively. Regular checkups and open communication with your healthcare provider are essential to ensure that PrEP is working for you and to address any concerns you may have. By working together, you can develop a comprehensive plan to protect your health and prevent HIV. Post-exposure prophylaxis, or PEP, is emergency medication after possible exposure. This medication is crucial in preventing the transmission of HIV after a person has potentially been exposed to the virus. It is a critical intervention that can make a significant difference in the outcome of such exposure. Post-exposure prophylaxis, or PEP, is an emergency medication that can prevent HIV infection after a possible exposure. It involves taking antiretroviral medicines for 28 days. These medications work by stopping the virus from establishing a permanent infection in the body. The sooner PEP is started, the better the chances of preventing HIV. It needs to be started within 72 hours of exposure. The effectiveness of PEP decreases with time, so it is crucial to begin the treatment as soon as possible. Ideally, PEP should be started within a few hours of exposure. Delaying treatment can reduce its ability to prevent HIV infection. PEP works by stopping the virus from replicating in the body. The antiretroviral drugs in PEP inhibit the virus's ability to multiply and spread, giving the immune system a chance to eliminate the virus. This process is vital in preventing the establishment of a long-term infection. PEP is not 100% effective, but it can significantly reduce the risk of infection if taken correctly. Adherence to the medication regimen is essential for its effectiveness. Patients must take the medication exactly as prescribed and complete the full 28-day course to maximize the chances of preventing HIV. If you think you may have been exposed to HIV, it is important to seek medical attention immediately. Time is of the essence, and the sooner you get help, the better your chances of preventing infection. Do not wait for symptoms to appear, as early intervention is key. A healthcare provider can assess the situation and prescribe PEP if necessary. They will evaluate the risk of exposure and determine if PEP is appropriate. If prescribed, they will provide guidance on how to take the medication and monitor for any side effects. Seeking prompt medical attention and following the prescribed treatment plan can make a significant difference in preventing HIV infection. The importance of testing. Knowing your HIV status is crucial. Getting tested is the only way to know for sure if you have HIV. Testing is readily available and confidential. You can get tested at your doctor's office, local health clinics, or through at-home testing kits. Early diagnosis and treatment are essential for managing HIV and preventing transmission. If you test positive for HIV, you can start treatment early and take steps to protect your health and the health of others. Breaking down stigma, compassion, and understanding for all. Stigma and discrimination surrounding HIV/AIDS remain significant challenges. It is important to remember that HIV does not define a person. People living with HIV deserve compassion, understanding, and support. We need to challenge myths and misconceptions about HIV/AIDS. Education and awareness are key to breaking down stigma. By treating everyone with respect and dignity, we can create a more supportive environment for people living with HIV/AIDS. A future free from HIV/AIDS. HIV/AIDS is a complex issue, but with knowledge, prevention, and treatment, we can work towards a future free from this disease. Understanding the causes, symptoms, and prevention methods is crucial for protecting ourselves and others. By supporting research, promoting testing, and breaking down stigma, we can make a difference in the fight against HIV/AIDS. Together, we can create a healthier and more equitable future for all.